You've probably been told that if you take your diabetes medication, watch your carbs, and follow your doctor's advice, your blood sugar should slowly come under control. But what if the real reason it hasn't is something no one ever mentioned to you? What if, despite doing everything right, your body has been quietly missing the very raw materials insulin needs to work at all? Here's the uncomfortable truth most people never hear. Insulin doesn't fail because you're weak, undisciplined, or careless. It fails because the system behind it is broken, and that breakdown often starts with invisible mineral deficiencies that standard treatment completely ignores. You can swallow pills every morning, inject insulin every night, and still watch your numbers barely move, not because the drugs don't work, but because your cells are starving. And this is where things get serious, because when blood sugar stays high, it doesn't just linger. It quietly damages nerves, stiffens blood vessels, strains your kidneys, and exhausts your pancreas day after day, often without dramatic symptoms at first. By the time most people realize something is truly wrong, the damage is already well underway. What makes this even more unsettling is that the research isn't new. The data has been sitting in plain sight for years, showing that without specific minerals, insulin resistance worsens, glucose stays trapped in the bloodstream, and medications are forced to fight an uphill battle they were never designed to win. Yet this information rarely makes it into routine care, leaving millions unknowingly treating the symptom while the root cause keeps growing. And once you see how this invisible deficiency cycle works, you can't unsee it, because it explains why so many people feel stuck, frustrated, and confused about their diabetes, even when they're trying their hardest to manage it. The real reason diabetes becomes so hard to control isn't because your condition is progressing faster, and it isn't because your medication suddenly stopped working. It starts much earlier, much quieter, at a level most people never think to question. Your blood sugar stays high because the system responsible for moving glucose out of your bloodstream is missing essential biological tools. And without those tools, insulin can exist in your body and still be almost useless. Here's what's actually happening beneath the surface. Every time your blood sugar rises, your kidneys work overtime to protect you by flushing excess glucose out through urine. But in the process, they don't just remove sugar. They also wash away critical minerals your cells rely on and to respond to insulin. Day after day, spike after spike, this creates a silent depletion cycle. The higher your blood sugar goes, the more minerals you lose. And the more minerals you lose, the harder it becomes to bring blood sugar back down. This is why diabetes often feels like a treadmill you can't get off. You eat carefully, you take your medication, you might even increase your dose, but the response never matches the effort. That's not a failure of willpower, it's biology. Insulin doesn't work in isolation. It requires mineral cofactors to bind to receptors, activate enzymes, and move glucose into muscle and liver cells. Without them, insulin resistance isn't just possible, it's inevitable. What makes this especially dangerous is how quietly the damage builds. Early on, the signs don't look dramatic. You feel tired even after sleeping. Your muscles cramp at night. Your heart flutters for no clear reason. You get brain fog, slower wound healing, numbness in your feet, and unexplained anxiety. Most people are told these are normal diabetic symptoms, when in reality, they're often red flags of deepening mineral depletion that's actively sabotaging blood sugar control. Studies now show that people with poorly controlled diabetes excrete up to 50–80% more key minerals through urine compared to non-diabetics. That loss directly worsens insulin resistance, increases post-meal glucose spikes, and forces the pancreas to work harder just to maintain baseline control. Over time, beta cells fatigue, insulin output weakens, and medication doses creep higher, not because the disease is aggressive, but because the foundation has collapsed. And this is where the cycle turns dangerous. Chronically elevated glucose doesn't just float harmlessly in the bloodstream. It stiffens arteries, inflames nerves, and damages the microscopic filters in your kidneys. Research consistently shows that prolonged mineral deficiency accelerates neuropathy, increases cardiovascular risk, and speeds the progression toward diabetic kidney disease, often years before symptoms become obvious enough to trigger alarm. The most frustrating part is that this root problem rarely shows up clearly on standard lab panels. You can be within range on paper and still be functionally deficient at the cellular level. That's why so many people feel like they're losing control despite doing everything they were told. They're treating the surface numbers while the deeper biological machinery keeps breaking down. But here's the turning point most people never hear. Once mineral balance begins to normalize, insulin sensitivity can improve rapidly. Glucose transport becomes more efficient. Post-meal spikes soften. Fasting numbers begin to fall, not because you added another drug, but because your body finally has what it needs to respond. This isn't theory. It's documented physiology, and it explains why addressing the root cause often produces changes medications alone couldn't achieve. And now that you understand why diabetes becomes resistant to control in the first place, the next question becomes unavoidable. Which specific minerals are missing, and how do you restore them before the damage goes any further? Because the first one may already be quietly draining out of your body every single day. Once you understand that diabetes becomes uncontrollable because your body is losing the very tools insulin depends on, the next question becomes unavoidable. Which tool is disappearing first? And in most people with diabetes, the answer isn't rare or exotic. It's magnesium, specifically a form your body can actually absorb, and use magnesium glycinate. Magnesium is not a nice-to-have mineral, it's a master regulator. Inside your body, it controls over 300 enzymatic reactions, many of them directly tied to glucose metabolism, insulin signaling, and energy production. But here's the brutal irony with diabetes: high blood sugar forces your kidneys to flush magnesium out through urine. The worse your glucose control becomes, the faster magnesium drains away, sometimes up to 50 to 80 milligrams every single day, creating a deficiency that quietly accelerates insulin resistance. This is why magnesium deficiency feels invisible at first. You don't wake up thinking, "I lack magnesium." Instead, your body whispers. Nighttime leg cramps start pulling you out of sleep. Your eyelid twitches for no reason. Your heart skips or races unexpectedly. Fatigue lingers no matter how long you rest. Anxiety creeps in without a clear trigger. And numbness or tingling spreads through your feet, often misdiagnosed as inevitable diabetic neuropathy, when in reality your nerves are starving for magnesium's protective effect. At the cellular level, the damage is precise and devastating. Insulin works like a key, but magnesium is the lubricant that allows that key to turn. Without it, insulin receptors become stiff, unresponsive, and inflamed. Glucose stays trapped in your bloodstream, poisoning tissues instead of fueling cells. Over time, your pancreas compensates by pumping out more insulin, which only worsens resistance and accelerates burnout. The data here is not subtle. Clinical studies show that supplementing magnesium in deficient diabetics can lower HbA1c by approximately 0.4 to 0.7% within just 12 weeks. Fasting blood glucose drops by 20 to 30 milligrams per deciliter. Post-meal spikes soften by as much as 25 to 40 points. Insulin sensitivity improves by over 30% as magnesium restores enzyme activity and receptor function. These aren't marginal changes, they're the difference between struggling control and measurable progress. And the benefits don't stop at blood sugar. Magnesium relaxes blood vessels, lowering systolic blood pressure by 8 to 12 points. It stabilizes heart rhythm, reduces arterial stiffness, and blocks calcium from hardening into plaque. Nerve pain eases as magnesium shields delicate nerve fibers from glucose-induced damage. Even kidney stress begins to slow as magnesium reduces protein leakage in urine and protects the filtration system from inflammatory overload. Now here's where form matters. Not all magnesium is created equal. Cheap forms like magnesium oxide are poorly absorbed and often cause digestive distress. Magnesium glycinate, however, binds magnesium to glycine, an amino acid that escorts it safely through your digestive system and into your cells. This form is gentle, highly bioavailable, and far less likely to cause diarrhea, making it ideal for long-term use in people with diabetes. In practice, most research-supported protocols use between 400 and 600 milligrams daily, split into 2 doses and taken with food. Starting low and increasing gradually helps avoid side effects. Magnesium glycinate also naturally supports relaxation and sleep, which further improves insulin sensitivity overnight. The primary safety consideration is spacing magnesium at least 2 hours away from certain antibiotics or bone medications to avoid absorption interference. But here's the deeper truth. Most people miss in magnesium doesn't just improve numbers, it restores responsiveness. It allows your body to finally listen to insulin again. And once that communication line starts working, something interesting happens. Cravings soften, energy stabilizes, post-meal fear fades. And suddenly the idea that diabetes must always get worse over time starts to fall apart. And yet magnesium is only the first leak in the system, because even if insulin receptors begin waking up again, there's another trace mineral quietly determining whether glucose ever makes it inside the cell, and without it, cravings, fatigue, and stubborn spikes can come roaring back even faster. Once magnesium begins restoring communication between insulin and your cells, many people expect blood sugar control to suddenly feel effortless. But for a surprising number of diabetics, something still feels off. Cravings linger, energy crashes return, and post-meal spikes show up when you least expect them. That's because insulin may now be knocking on the door, but another trace mineral decides whether the door actually opens. That mineral is chromium, and in its most effective form, chromium picolinate. Chromium works at a deeper signaling level than most people realize. Its primary job is to activate insulin receptors, the molecular switches that tell your cells, yes, it's time to let glucose in. Without enough chromium, insulin can be present in normal or even high amounts and still fail to do its job. Glucose remains stranded in the bloodstream while your cells behave as if they're starving. This disconnect is one of the most overlooked drivers of insulin resistance. The problem is modern life quietly strips chromium away. Highly processed foods remove up to 90% of chromium from grains. High sugar diets increase chromium loss through urine. Chronic stress burns through chromium reserves at an accelerated rate. Every spike you experience doesn't just raise glucose. It pushes chromium further out of your system, tightening the metabolic trap. This deficiency rarely announces itself clearly. Instead, it shows up as relentless cravings, especially for sweets or refined carbs. Afternoon energy crashes hit hard. Brain fog makes simple decisions feel exhausting. Mood swings appear without warning. Hunger feels constant even after eating. Weight collects stubbornly around the midsection. And between meals, shakiness or lightheadedness creeps in, signals often blamed on blood sugar issues when chromium depletion is quietly amplifying the problem. At the biochemical level, chromium acts like an amplifier for insulin. It increases insulin binding to receptors by up to 40%, meaning the same amount of insulin suddenly works far more efficiently. Clinical trials consistently show that supplementing chromium picolinate at 200 to 400 micrograms daily can reduce HbA1c by approximately 0.5 to 0.8% within 12 weeks. Fasting blood glucose often drops by 15 to 25 milligrams per deciliter, while post-meal spikes soften by 20 to 35 points. But chromium's influence doesn't stop at glucose entry. It also reduces excess glucose production in the liver, cutting one of the most stubborn sources of elevated fasting sugar. Muscle cells begin storing glucose as glycogen instead of converting it into fat. Insulin sensitivity improves by as much as 35 to 45%, while insulin resistance declines dramatically as metabolic signaling pathways regain clarity. The ripple effects extend beyond blood sugar. Triglycerides fall, HDL cholesterol rises, LDL particle damage slows, blood pressure trends downward as vascular function improves. Neuropathy symptoms often ease as nerve cells experience less glucose-driven toxicity. Even kidney stress begins to stabilize, with studies showing reduced protein leakage and slower progression of diabetic kidney disease when chromium status is optimized. Chromium picolinate stands out because of its bioavailability. The picolinate form binds chromium to picolinic acid, allowing absorption rates up to 3 times higher than other forms. Most protocols use 200 micrograms once or twice daily with meals. Side effects at these doses are rare, but exceeding 1,000 micrograms daily long-term is not advised due to potential kidney strain. Because chromium enhances insulin action, blood sugar should be monitored closely if you're using medications, especially during the first few weeks. What makes chromium so powerful is how quickly people feel the difference. Cravings soften, energy steadies, hunger signals normalize. Blood sugar becomes more predictable instead of chaotic. And when magnesium and chromium work together, insulin stops shouting and starts communicating. But even with receptors activated and cravings under control, there's still one more critical bottleneck: of mineral stored heavily in your pancreas itself. that determines whether insulin can even be produced and released properly in the first place. And without it, control can unravel just as fast as it improves. Once chromium begins calming cravings and helping glucose finally enter your cells, many people assume the worst is behind them. Blood sugar feels more predictable. Energy improves. But beneath that progress, another vulnerability often remains, one that sits directly inside the pancreas itself. Because even if insulin signals work perfectly, they're useless if insulin cannot be produced, stored, and released correctly. And that entire process depends heavily on one mineral. Most diabetics are quietly deficient in zinc. Zinc is concentrated in the pancreas for a reason. It plays a critical role in how insulin is synthesized, packaged, and released into the bloodstream. Without enough zinc, insulin production becomes erratic, storage breaks down, and release timing falters. Blood sugar swings become harder to predict, not because you ate something wrong, but because the pancreas can no longer respond with precision. The danger is how slowly zinc deficiency develops. You don't feel it overnight. Instead, wounds start healing more slowly. Minor cuts linger for weeks. You catch infections more easily. Hair thins. Skin breaks out. Taste and smell become dull. Appetite fades or becomes inconsistent. Fatigue deepens. Brain fog thickens. And blood sugar begins swinging without clear triggers, leaving you confused and frustrated. At the cellular level, zinc acts as both a builder and a shield. It stabilizes insulin molecules, protects pancreatic beta cells from oxidative stress, and reduces inflammation that interferes with insulin release. When zinc levels drop, beta cells become vulnerable. Insulin output weakens. Over time, this accelerates the progression from insulin resistance to true insulin insufficiency, a turning point many diabetics don't realize they've crossed until control becomes extremely difficult. The research here is striking. Clinical trials show that zinc supplementation can lower HbA1c by approximately 0.5 to 2% within 3 months. Fasting blood glucose drops by 15 to 25 milligrams per deciliter. Post-meal spikes become less extreme as insulin release becomes more synchronized with glucose intake. Insulin sensitivity improves by 20 to 35% as cellular signaling stabilizes. But zinc's impact goes far beyond blood sugar. Inflammation inside blood vessels decreases, reducing cardiovascular strain. Oxidative damage slows protecting arteries from premature aging. Nerve fibers regain protection, easing tingling and numbness that often signal early neuropathy. Kidney filtration improves as zinc reduces inflammatory stress on delicate renal structures. Even the eyes benefit. Zinc helps protect retinal tissue, lowering the risk of diabetic vision damage. In practice, zinc picolinate stands out for absorption. The picolinate form allows zinc to cross intestinal barriers efficiently and reach tissues that need it most. Most therapeutic protocols fall between 30 and 50 milligrams daily, taken with food to avoid nausea. Exceeding 100 milligrams long-term is not recommended, as excess zinc can block copper absorption and weaken immunity over time. Spacing zinc several hours away from certain antibiotics is also important to avoid interference. What makes zinc especially powerful is its stabilizing effect. Blood sugar becomes less reactive. Healing improves. Immunity strengthens. The pancreas regains some of its lost rhythm. And for many people, this is the moment diabetes stops feeling unpredictable and starts feeling manageable again. But even with insulin production restored, another silent threat remains, one that doesn't just affect blood sugar, but determines how quickly oxidative damage, inflammation, and long-term complications progress throughout the entire body. And the mineral responsible for controlling that damage is often the most misunderstood of all. By the time zinc restores insulin production and brings stability back to the pancreas, many people finally feel a sense of control returning. Blood sugar swings calm down. Healing improves. Energy feels steadier. But there's still a deeper layer of damage that doesn't show up on a glucose meter: oxidative stress. And if that layer isn't addressed, diabetes keeps aging your body from the inside out. This is where selenium, in its most usable form, selenomethionine, quietly becomes a deciding factor. Selenium doesn't work by forcing blood sugar down. It works by protecting the very cells responsible for controlling it. Inside your pancreas, thyroid nerves, and blood vessels, selenium is required to activate glutathione peroxidase, one of the body's most powerful antioxidant enzymes. Without enough selenium, insulin-producing beta cells are left exposed to constant oxidative attack from high glucose levels. Over time, they weaken, malfunction, and die off far faster than they should. The danger is how subtle selenium deficiency feels at first. You don't connect it to diabetes. Instead, you notice relentless fatigue that sleep doesn't fix. Your muscles feel weaker. Hair becomes brittle. Nails develop white spots or ridges. Brain fog thickens. Mood swings appear. Your immune system falters, leaving you sick more often and slower to recover. Beneath all of this, oxidative stress keeps quietly accelerating nerve damage, kidney strain, and vascular aging. At the biochemical level, selenium acts like a fire extinguisher. It neutralizes free radicals generated by chronic high blood sugar before they can destroy cell membranes and DNA. Studies show that adequate selenium intake improves insulin sensitivity by up to 30–40%, reduces inflammatory markers by over 30%, and protects pancreatic beta cells from further decline. Clinical data suggests that supplementing selenomethionine at 200 micrograms daily can lower HbA1c by approximately 0.6 to 1.4% within 3 months, with fasting glucose dropping by 18 to 30 milligrams per deciliter. But the benefits extend far beyond glucose control. Selenium improves blood vessel flexibility, reducing stiffness that drives high blood pressure and heart disease. It slows the progression of diabetic neuropathy by protecting the myelin sheath around nerves. Kidney filtration markers improve as selenium reduces oxidative injury to delicate renal filters. Even liver detoxification becomes more efficient, helping the body clear metabolic waste that worsens insulin resistance. Selenomethionine matters because form matters. This organic form mimics the amino acid methionine, allowing absorption rates close to 90%, far higher than inorganic selenium forms. Most evidence-based protocols use 200 to 400 micrograms daily, taken with meals that contain healthy fats for optimal absorption. Staying within this range is critical. Excessive selenium intake over time can cause toxicity, leading to hair loss, brittle nails, digestive distress, and neurological symptoms. When selenium is restored, something important shifts. Inflammation cools, cellular aging slows, complications stop accelerating. Diabetes no longer feels like a fire, spreading uncontrollably through the body. It starts to feel contained. And now when you step back and look at the full picture, magnesium restoring insulin, response chromium, activating receptors, zinc stabilizing production, and selenium protecting cells from destruction, a final realization becomes impossible to ignore. What happens when even one of these is missing? And how many people are unknowingly making that exact mistake every single day? At this point, the most important thing to remember is this: you are not powerless in this process. Blood sugar doesn't spiral out of control overnight, and it doesn't improve overnight either. But when you understand the biology behind it, every small informed step you take starts to shift the direction. You don't need to change everything at once. You don't need perfection. You just need to start paying attention to what your body has been quietly asking for. Begin small even today. Focus on restoring what your system has been losing, supporting insulin instead of fighting it, and giving your cells the tools they need to respond again. When you do that consistently, something changes. Numbers begin to stabilize. Energy feels more predictable. Cravings lose their grip. And over time, the fear and confusion around blood sugar start to give way to confidence and control. If this video helped you see your health from a new angle, do yourself a favor and save it so you can come back to it later. These are the kinds of insights that matter most when you revisit them, not just when you hear them once. And if you want to stay informed with the latest research-backed, easy-to-understand medical knowledge for managing blood sugar and protecting your long-term health, make sure you subscribe to the channel and turn on notifications. I also want to hear from you. Let me know in the comments what stood out to you the most, or which step you're planning to start with first. Your questions and experiences matter, and they help shape the next conversations we have here. Take care of yourself, stay curious, and remember, informed choices made consistently can change the course of your health.